Hello everybody, let's start a new story. We are going to narrate the story of Ascaris lumbricoid, the giant intestinal roundworm. Ascariasis is a helminthic infection, and man is the only definitive host. The story starts when a patient defecates in soil. Under the favorable environmental conditions, Ascaris eggs mature in soil to develop rhabdidiform larvae in 2 weeks. It contains rhabdidiform larva, which is the infective stage of the worm. A man is infected by ingestion of impregnated eggs with raw vegetable fibers. When eggs pass to the small intestine, they hatch rhabdidiform larvae that pierce the blood vessels of the intestinal wall. To the right side of the heart. To the lung, where they break out in the alveoli, resulting into Laffer syndrome, similar to that occurs in Ancylostoma duodenale and Strongylosis circularis larvae. Larvae ascend the respiratory tree to the larynx. Then they are swallowed to reach the small intestine to become adult. Ascaris causes tissue damage due to its large size and toxic byproducts. The toxic byproducts in sensitized persons may cause edema of the face, urticaria, asthma, type 1 hypersensitivity reactions. To sustain its existence, Ascaris worms reproduce sexually, and up to 200,000 eggs are produced per day. Due to this large number, unfertilized eggs may also be present. And now let's see different scenarios for this worm. In normal physiological conditions, different digestive enzymes are produced to break down proteins. These digestive enzymes can also digest and break down Ascaris worms. However, Ascaris worms produce anti-enzymes to protect themselves from being digested. At this instance, when the patient ingests meat, he will suffer protein maldigestion. The patient also suffers changes in bowel movements, malnutrition, and underdevelopment of children. When the patient visits the internal medicine physician, the routine stool analysis may discover the infection. And the patient can be treated by single dose of albendazole. However, sometimes the infection is discovered using a plain X-ray or barium meal. And now with the scenario number 2. When the worms become irritated by fever, drugs, or anesthesia, they migrate. If the patient is lucky enough, worms pass through the anus in large numbers. However, in other instances, worms may migrate through the respiratory canal to the appendix, causing appendicitis, or through ampulla vater, causing acute cholecystitis or acute pancreatitis. Ultrasonography and RCP are mandatory to approve the diagnosis. Scenario number 3. The parasite may occur in large numbers, causing intestinal obstruction, a condition that necessitates emergent surgical intervention. Scenario number 4. When the patient with Ascaris infection undergoes surgery, and worms become irritated by anesthesia. They migrate from the small intestine to the respiratory canal, causing suffocation and sometimes patient death. And by the end of our story, I hope it was interesting for you. Bye bye!